You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Welcome everybody to another episode of Vet Synapse. I'm Philip from Vet Education, your host today, and we're thrilled to welcome back Dr. Phoebe Fear, who's the Veterinary Operations Manager in Companion Animal and Equine at Zoetis. Dr. Fear, thank you so much for taking time out of your very busy schedule to share your knowledge with us today. We're going to be talking today about a really exciting product for dermatological cases called Cytopoint. But before we do that, I know for those of you who've listened to the podcast that we did on Apoquel, you know that we took a trip down memory lane into the dark old days where we had nothing but an itchy dog and a bottle of prednisolone, and there's a bunch of new things that are available, amongst them Apoquel and Cytopoint. But as with any disease, animals come in with an itch, sometimes with an underlying disease behind it. Dr. Fear, I'm just hoping that you can take us on a little bit of a journey through the diagnostic pathway before we get into talking more specifically about antipruritic therapy.
Great. Thanks for having me, Philip. I'm really excited to be back again. And yeah, why don't we jump straight in and have a bit of a chat about allergic skin disease in dogs. So an itchy dog coming into the clinic, you guys all know it's one of the most common presentations. These dogs come in very frequently. The owners bring them in because they're scratching, or they've been keeping them up all night, or they're licking or rubbing at themselves. So this behaviour is that driver for the owner to seek veterinary treatment. And we understand that stopping the itch is the main goal for the pet owner. However, as veterinarians, what we want to do is to have that itch stopped longer term. So what we want to do is look to diagnose that underlying reason as to what's causing the itch to ensure that we've got an appropriate diagnosis and therefore management can be instigated for that problem. So what Zoetis has done, we've worked with some Australian veterinary dermatology specialists all around the country and created some guidelines that will support GP vets in managing and diagnosing pruritic conditions. And they provide a clear process to follow for these patients. It includes initially instigating treatment to stop the itch. So we do want to get these dogs comfortable and keep their clients happy that you've been able to do something for their dog. But during that time, it provides a step-by-step approach in what you need to do. So you'd need to rule out parasites, treat any underlying skin infections, and then where appropriate, conduct additional testing such as food elimination trials before being able to diagnose atopic or allergic dermatitis, which is essentially by ruling out some of those other causes first. So these guidelines, they will then help you form an ongoing management plan, especially for these chronic cases who may require multimodal therapies as well. So that's, I guess, the sort of starting point in terms of where to go to in terms of working up some of these cases.
Excellent. And these guidelines are really, really helpful. And you've been kind enough to supply us with a copy of those guidelines that we have. If you'd like to hear more of this podcast, why not become a Vet Education member, where you'll not only get access to podcasts, but our entire webinar library, plus a huge journal library, special offers, discounts, and a whole lot more. Check out the website veteducation.com for more details.